Hey, welcome back. I'm going to just talk a little bit today about this is part of the hip replacement, like my second video. This is actually I just had my pre-op visit a couple days ago. Still, my surgery is not for another week or more, over a week. But just wanted to kind of talk about just what I went through, in case you're going through this. Had to go down and do a little, takes about 45 minutes to an hour or something, at least it did for where I went. And it was just a pre-op thing. They drew some vials of blood and they put things on me and ran a little short EKG deal. Said they were going to, in the paperwork said they were going to do a chest x-ray and a urine test and the blood test and the EKG and all that. But apparently my doctor was a little different. So he may or may not have that stuff. He didn't do the urine test and he didn't do the chest x-ray. But then I don't know if it's a doctor or it wasn't on the paper from my doctor, but the hospital anyway did a MRSA, MRSA, SSA. It's two different forms of a staph infection that Staphylococcus something. Anyway, they just swab, take a little, sterile Q-tip looking thing. They just rub around in your nostrils. And then to it, plug it up, they send it off. Hadn't heard back from that. They said no news is good news, but apparently 30% of the people have this MRSA virus, this Staphylococcus virus on their body. Doesn't hurt them, they just carry it. And it gets in, you can tell it from your nose. Now that I'm talking about my nose itches. So this whole process of this test is to find out if I have it. If I have it, then they're going to give me some ointment I got to rub up in my nose. I think they said for 4 or 5 days before the surgery. And then they gave me this stuff to shower in the night before my surgery and the morning of my surgery. I might do my hair, my whole body, and they even give you a little, I don't know what you call the thing. It's like a wash sponge thing. It's not even a sponge. It's, anyway, whatever it is. It's a whole bunch of nylon. It looks like nylon string all rolled up in a ball. And I guess you soak it down with stuff and scrub your body with it. And I had to do that, like I said, the night before and the morning of my surgery. Now, my surgery is not till 1:30 in the afternoon, so I don't have to be at the hospital till, or 1 o'clock in the afternoon, so I don't have to be at the hospital till 11 a.m. So I'll do it in the morning. Plus we got an hour and a half drive or so to get to the hospital. And then, but if I have that MRSA, if it comes back positive, then I have to also take a shower in that stuff every night for 4 or 5 nights, in addition to the night before and the morning of. And it's just to keep, if you get that infection all over your body, they just don't want it getting into your incision and causing an infection. Because if you get an infection in these joint replacements, they can't just give you antibiotic pills or something. They have to go in and flush it out. If it's really bad, they have to actually take all the metal out, put some kind of an antibiotic block. I don't even know what that is. But it's something they put in between the joint with no metal. So now they've cut the joint off. There's nothing there. They just put that there. And you have to stay like that for days or weeks or months. I have no idea how long. And then once it's all healed up, then they go back and put the metal back in. So they're in and out of you 3 times at least that if you have an infection that's real bad. Somebody I know had a knee replacement and they had an infection. A red spot came up on their knee, and the physical therapist, they said something about physical therapy, and he said he thought it would be okay. And they're like, no, you call the doctor now or we'll call him. So he called the doctor. They went in. They had to go back in and clean his whole knee out. But he was fine at that. They cleaned it out, put it back together, and he never had another problem with it. A lot of people don't get any kind of infection, but the infection part scares me. I know one lady that she actually had a hip replacement, got an infection, got sepsis, and where it fights your whole body, and it killed her. Maybe 4 months later or something, 3 or 4 months after she had her hip replacement, she's dead. And then blood clots are a bad thing. Another lady I know, she was doing fine from her hip replacement. The night had a blood clot, killed her, and just out of the blue. So infections are serious. So they tell you to clean up with that shower, do all that stuff to keep the infection down, then just do it. So we went to after that, all the blood work tests. We went to a class for joint replacements. It covered hip and knee replacements. Didn't talk about shoulders, just hips and knees. And so they had several people in there that were having various, and it's put on by the hospital, but they're having various joint replacements. And they went into the parts about if you came through on the hip, coming in the front versus the back, what you can do, what you can't do, how soon because you start your physical therapy differently. Like if they come in for your hip from the front, I think they say you have to wait a week before you start physical therapy. If they come in from the back or side, kind of like they're doing with mine, they want you to wait 2 or 3 days to start physical therapy. Then it's like, all the little stuff. They really didn't cover how to get out of cars, how to get into bed, how to do any of that stuff. They said they will cover that with us after our joint replacement, and we're in the hospital. They'll come in, the physical therapists will come in, and they'll teach you all the stuff you need to know. But they just said, they'll be coming in, and different stuff like they're going to have waterproof bandage on it to take a shower, but I can't get into a tub or a pool or nothing. Don't submerge it, but I can take showers and stuff. And they'll probably get me up that day, send me home the next day. So a lot of the older people that I know, older than me, that had hip replacement from the hospital for 5 days at least, they don't do that anymore. He says that some of them send them home the same day. And one, she was a physician assistant, was talking to me, and she said that she knows of one doctor, I forgot where she said he was at, said 95% of his knee replacements are done outpatient. He's basically, you just come home the same day on a knee replacement, which is more, extensive than a hip replacement. But they just start getting you up on your feet and sending you home as fast as you can. So we'll see how it goes. I'm supposed to go in, since mine's at 1:30. The PA I talked to, after the class, I had the class, wife and I ate some lunch, and then we went to see the doctor, which actually saw his PA and not him. And she said, he may, because I've got type 2 diabetes and stuff like that, he said he may decide to keep me an extra day. It may not. I don't see why he would, but if he does, he does. And so that was about it. Just in case we had any questions or anything. Now all I have to do is, they said I'll be on pain medicines for I thought it'd be pretty good pain for about a week. They said everybody's different. And some people go 2 weeks on pain medicines. I don't like the pain medicines because it stops you up. You have to take all the stool softeners and all this other fun stuff. It's not fun. So anyway, we'll see how it goes. And I probably won't do another update until after the surgery. But I wanted to let you know what the pre-op visit was like. And it took up, for me it went from 10 a.m. until about 1:30 to 2, somewhere in that ballpark. So, it took a little bit of a time, but got through it all. It was nothing major. It's just, worst thing for me is it's a long drive into, we gotta go. It's over an hour's drive to get to the hospital. So, we'll see how it goes. Anyway, have a blessed day. We'll play around the shop a little today, since before I get my hip replaced. So, have a little fun before I'm laid up. Have a blessed day. We'll talk to you later. Bye.